Welcome to Via Voices, the podcast dedicated to exploring the many facets of assisted living and memory care. In each episode, we will delve into a range of educational topics featuring expert guests, real-life stories, and practical tips and guidance to empower seniors and their families. Via Voices is your trusted resource for making informed decisions when it comes to senior living. Hi, everyone. I'm Andy Briefer, owner and CEO of Via Elegante. Today, I'm joined by Amy Schumann, a registered nurse and executive director of our Sierra Vista communities, and Ira Branson, our executive director of our Tucson communities. So you guys ready?
We're ready.
Let's jump in. So today, we're going to talk about hospice. And hospice is a scary word to many people. Oh my God, hospice, that means death is imminent. And so many people really don't understand what hospice is, how it works, and how it really can be beneficial and provide positive change for residents that go on hospice. So I have a nice story to tell you about hospice. We have a lady that lived with us for over a year. She was on all kinds of medications, stuck in bed all day. The family was really concerned, and she was just not thriving. And the family was adamant that they did not want her on hospice because they thought if she goes on hospice, she's going to pass. And they didn't want to lose their mom, and I completely understand that. Well, they finally came around and decided to put her on hospice. When she went on hospice, the hospice operator took her off all of her medications, and the family thought that's going to be it. Well, lo and behold, it was like a little miracle. I mean, she started getting better, she was getting out of bed, and she was on no medications. And she still stayed on hospice and was with us for like another 18 months after that happened. But it was eye-opening for me as I was first getting involved in assisted living, just to learn that hospice is not a terrible thing. So Amy used to work with a hospice and knows quite a bit about it. So we're in really good hands to have Amy here. So what do you think?
So like Andy said, there is a stigma around the word hospice. A lot of people think, oh boy, I'm going to go on hospice. It means I have 6 months or less to live. It's not the case. There's a lot of things that go into determining whether or not somebody qualifies for hospice, first and foremost. So there's not necessarily the need to feel a sense of fear of whether or not you're making the right decision. If your loved one doesn't qualify for hospice, then clearly that's the decision that's going to be made at that time. If they do qualify, it also doesn't necessarily mean that in 6 months they're going to pass away. So in doing hospice, I have done both case management and admissions for hospices. And in that, I've seen everything from they come on and they pass away within a few days, or they come on and they last over a year with hospice. So there is a recertification process that happens with hospice. Every 30, 60, 90 days, depending on where they are in their benefit period, they are recertified by a registered nurse and a nurse practitioner or an MD to come in and take a look at where they are in their disease process. Have they had a decline? It doesn't necessarily mean that the disease has progressed to where now they think that they're going to pass away and they're imminent, but what it means is there has been some form of a decline. Maybe mom is eating less, she's losing a little weight, she's sleeping more, she's no longer ambulatory like she was previously. So they take into consideration all of these things as a whole. It's not just a matter of whether or not someone is going to pass away. It really is, what is their diagnosis that is causing the admission? And where are they in the disease process? And are they continuing to progress with that disease process?
So if somebody goes on hospice, are they like precluded from going to the hospital if something happens?
It depends on what.
It depends on what it is.
So give me some examples.
For example, the resident falls, hits their head. They have a a gash on their head. It doesn't necessarily mean that we're not going to treat that. We still contact hospice, let them know what's happening, and then they will instruct us to go ahead and get them sent to the ER, get stitches, and then the resident's able to return back to us with hospice still in place. They'll come back, reassess, and still follow the resident at that point.
So I've seen where families are like, we can't send them to the hospital, so we're going to take them off hospice and then send them to the hospital. Can you give me an example like that?
That does happen if they are sent to the hospital and they require more in-depth testing. So if the family wants to, what that is considered is they want to pursue treatment. Hospice does not support pursuing treatment for something that is life-prolonging.
Right.
So if they wanted to have the CT scans, the MRIs, they were admitted to the hospital because they had a fall with head injury and maybe had a hematoma that required admission. That is where you cannot be on hospice and be in the hospital. If it's for the emergency room to stop the sudden onset acute symptom, you can go to the emergency room. I had a patient at one point that was seizing. We were doing all of the medications in the home. We were doing rectal meds. We were doing oral meds. We were doing everything you can think of to stop these seizures. I couldn't get them under control in the home after several hours, so we called an ambulance. We had her taken. I followed the ambulance to the hospital, let them know she's on hospice. I just needed the seizure stopped. Once they got the seizure under control, we were able to take her back home, and she was able to pass away peacefully with her family. So we're not going to watch them suffer. I think that's the biggest thing that I want families to know is if your loved one has an infection, a UTI, pneumonia, things like that, they can still get antibiotics while on hospice. This isn't the end-all, be-all. And like Andy said, they do sometimes come in and discontinue all medications, but 9 times out of 10, they are slowly taking away medications one at a time as they're discovering what your loved one is on. Sometimes over a lifetime, these folks end up on so many medications, they don't know what they're for. They don't necessarily need them. And so as a hospice, they're looking at what exactly are they on. And usually it's a slow process to discontinue the medications as they're no longer required for these folks. And you do see some improvement sometimes because they're on medicine that they don't need all the time.
Right. And just because you're on hospice, you can still get medication.
Absolutely.
Right? It's not like they cut your medication, so we don't want to confuse that issue.
Right. So when you say they stopped all medications, sometimes what will happen is as you get to end of life, you can't swallow. At that point, there is a consideration for safety. We don't want you to aspirate. We don't want you to develop aspiration pneumonia. So we are really limiting those medications to those that are bringing comfort and are not putting you at risk of an acute situation.
So when people go to assisted living, do they have to leave to go on hospice?
No, they do not have to leave. Hospice can serve in all of the communities here in town, including SNFs. So it's
SNF,
a skilled nursing facility. So it's they absolutely do not have to leave. They can stay where they are the most comfortable with the caregivers that is that's been caring for them for the past 2-3 years. So.
And can they stay at home and be on hospice?
Absolutely. Absolutely. Hospice services will bring, all of the equipment that they require, from oxygen to hospital beds to all of their medications to nurses' visits, aides that will come in to be able to assist them with showering and bathing. So, hospice, like you guys said, it's not the end all be all. It's additional services for that, for your loved one. It's not, they are still able to graduate from hospice, to be able to get off of hospice if they see that they're getting better. But
and is it expensive?
It's covered by Medicare.
Oh, so they paid for it their whole life.
Exactly.
And it's there.
Exactly.
So if you're caring for a loved one at home, it might be like a little weird, like, oh my God, they're going to die here or something like that. And you might be worried about that. A lot of people are, and then they move to assisted living and then visit mom there and let us take care of her 24/7. But hospice comes in to our assisted living and supports our caregivers and supports the family. The other nice thing that happens is if mom needs a better bed or a better wheelchair, it's covered by Medicare, and it's ordered by hospice, and delivered either to your house or to the assisted living
Assisted
community?
living, they require specialized beds. We're able to request that from hospice and get that in for them, just depending on what their requirements are for
So
for
a specialized bed, talk about that. What would that be?
Just depends on what kind of bed they're in. We can do anything from hospital beds, bariatric beds. We have some high-low beds if mom is constantly falling out of the bed. These beds will go all the way to the floor so that she's only falling the distance of the mattress versus the height of the actual bed frame. So those are really nice options.
If they have extensive wounds, we can get specialized mattresses for them.
Oh, the kinds where the air blows up and goes down and keeps things
mattresses.
circulating.
Yeah.
What's that called?
An APP overlay.
APP
So
overlay.
it's air pressure
Okay.
that goes through the mattress. I just want to hit on one thing that you mentioned, which was the multidisciplinary team. You mentioned aides and nurses, but one thing a lot of people don't know is hospice is the only Medicare-approved benefit that will treat the family. So you also have social work that will come into your home. With a licensed social worker, you have a chaplain so that mom doesn't lose that sense of her religion as well. And they're there to support you. And this is one benefit that really is great for the family. And having done hospice, it's obviously a journey from beginning to end, not just for that patient, but for their family as well. So it's nice having those professionals that can come in and help you make end-of-life arrangements, help you sort out anything that is still pending that may be a little bit messy towards the end of life, like finances, decision-making, funeral homes, any of those things. They are there to support the family in that as well. So I just want to let families know that that is something that is crucial to their involvement with their loved one, and that support is there, and they can let them know, hey, this mom is getting to a level of care that maybe you can't provide in the home, or that would be more beneficial if she was placed in an assisted living. They're there to help find that placement, help hold your hand through that, and make sure that you have the resources that you need to get through this journey as well.
And taking it a step further, what I understand and what I've learned in my 20 years in this business is people develop attachments beyond the family to the people that they take care of. And, we see everyone's faces, we talk, but the people that develop the closest bond with the residents are the caregivers that work with us, that are spending 24/7 with them and learning to anticipate their needs and their wants. And it's sad when somebody passes away, and the caregiver sometimes needs support as well.
Absolutely.
And hospice also provides support to our caregivers as well as the family.
Absolutely.
And that's a really wonderful benefit.
Yep. We've seen it through the years of residents coming and, passing away in the arms of our caregivers. And that truly hits home for them. It's hard, it's difficult, they're emotional, and they require that support as well. And knowing that they're also grieving when we lose a loved one in the community.
I've counseled many of our caregivers, and just letting them know that they are angels and they were put here for a purpose, and they really enhance the life of the person that was on hospice that passed away, and they were blessed to have them in their presence over that journey. And you guys have all been in that situation. The other nice thing about hospice in an assisted living setting and in a home-like environment that we have is for the families to know that mom and dad are in good hands. Sometimes we'll let them know they can go home, and if we see something happening, we'll call them. They can come right over. So we have great communication about that. Do you have any stories about that or any thoughts about how we've done that in the past?
We have, and we've also allowed family members to just spend the night when we know it's getting close. Having that the ability for them to just stay with their loved one, with their mom or with their dad, gives them a lot more comfort. And knowing that hospice is just a call away when there is an issue that pops up for them, it's huge for them.
And it's comforting to know, we can't promise that somebody will be in the room at the exact moment unless we're doing 24-hour care and having someone set to do that. But it's nice to know that someone's not alone when they pass away. So
Absolutely.
I remember holding my mom's hand when she was on hospice, and she was on a lot of morphine, and she started singing Zippity Doo Dah. Zippity Doo Dahs, because she saw little birds flying all around. Yeah. But my sister and I were there and holding her hand. And I think with hospice, you can be there. You get good counseling from, okay, this is what's happening now, and it's probably imminent. It's probably within the next 48 or 24 hours. And hospice can guide you through that process so you can make sure you're available, or the family can come in and be there. So it's that great communication can really help make that final part really special.
Absolutely.
So on this journey on hospice, we know it's not the immediate situation, and we know that the most important thing in being in an environment like maybe an assisted living environment and having hospice there is you'll get great communication. And as a matter of fact, that's going to be our next podcast. We're going to talk about how important communication is, because it's no fun to be left in a black hole when you drop off your loved one at assisted living and not know what's going on or not have adequate communication from the entire team. So with that, stay tuned. We'll see you at our next podcast.
Bye, guys. Bye.
Thank you for listening to and watching Via Voices, the podcast dedicated to exploring the many facets of assisted living and memory care. If you found today's episode informative, be sure to subscribe and tell a friend about us. We look forward to having you join us next time on Via Voices.